Hi everybody, it's Sunday afternoon and I wanted to do this video to help you understand and feel better about concept mapping. After our conversation Friday in several of the sections, there were a lot of questions about mapping and many students came forward who didn't quite feel comfortable with the mapping. So let me just address that, and I'll be going back and forth also to my computer screen, and because I have a little PowerPoint slide, but I'd rather do this face to face. So the first thing I would say is, to some degree, having kind of trouble with concept mapping and getting through it is not brand new to students. Okay, maps, even if they're simple and static, are asking you to think through things at a higher level. We have a lot of application and even the beginning of analysis in maps, and it's not comfortable for students. Also, what enters into this picture, which is in the mapping book, is about the processing of your brain. Okay, now most of us realize, your brain works as a cohesive whole most of the time, but there are certain, for most people, one side of the brain can dominate, and that, along with learning style, really impacts learning and how things are processed. So some of you who aren't quite getting them are probably just getting used to a different way of looking at this, and it's going to take a little bit of time to get comfortable, but you will get there. I've never had anybody who really couldn't grasp them at all, and you will be fine if you just listen to a few of these fine points and do some more practicing of the maps. So the other thing is that I think for some people the question wasn't about the map as it was knowing the content. And so if it's something that you're really stumbling with, of course, you're not going to think at those higher levels to make a map if you don't even understand a concept. So we're going to talk about that a little bit too. But I'm hoping that in the end, when we're finished, that will help you and help you feel better about this and get to a place of positivity. So we're going to move into care planning tomorrow, but we'll spend a little bit of time just answering questions. And if beyond that, if people are having difficulty, I want you to set up appointments to see me so that we can talk about the maps and talk about, your processing and not take from class time, because that will help you more. It will help us have a quieter setting to do it in and get people on a better track. And I'll do that at any time for anything to sit with you guys, as I have done with the med math. So the first slide I have here is using concept maps successfully. If I ever finish this whole slide presentation, I'll post it, but it really isn't about having this presentation. It's just about thinking about some examples. And sometimes I can say that better verbally than drawing it out through this method. So the first thing I would say to you, before you create a map, the first thing you have to do is consider the topic that you're looking at and how well do you think you understand the content. So no matter what it is, and I'm going to use the NANDA example because a lot of people stumbled on that the other day. Okay, NANDA, you have to go back to your readings, back through your notes, and figure out how well you know NANDA. That takes you from just knowledge and comprehension and moves it to application. Okay, because NANDA is nothing more than an approved language, and we put nursing diagnoses into. The nursing process and NANDA, okay, are independent nursing actions. Nursing care plans are from nurses. It's about our scope of practice and things that we can do without a physician's order, and NANDA is one way to make the nursing diagnoses, to word them. Okay, there are 13 domains, and it tells us we can only use approved language. So if something doesn't fall in those domains, it's a non-NANDA, and that's where the comparison contrast is. So look at the content and then think about what is the purpose of the map. Because the purpose of the map, for our intents and purposes in this course, will become the main focus. So whether you use a circle, a square, a rectangle, that's the beginning of your map. Okay, and from that, you're going to have a few associated concepts, usually 2 or 3, that you'll choose, and then you'll have to develop the map. So if you can't even come up with associated concepts, okay, then you don't understand that content beyond knowledge, and that's a problem heading into a mid-semester exam. So that means you needed to be studying more ahead of time. You needed to be tying together the ATI content with what we had in class, because it was all addressed in some way, shape, or form, and coming forward to get some help, because this content was covered in many different ways and layered in many different ways. So it should not be stumbling with that at this point in time. So if that truly was the problem, go back and check out the content and see me additionally, okay? Then also picture yourself and make yourself mentally, okay? Get in a place of quiet and walk through the map. So if you say, okay, my focus on my map today is going to be NANDA, okay, what do I remember about NANDA? And let me walk myself through how I would use it in planning care. Because where is NANDA used? Okay, it's used in a nursing process and a nursing diagnosis phase, okay, to word the problems that the patient has in the NANDA format. And that's the best way I can possibly explain it. But walking yourself through it is the same thing you're doing when you're reasoning at higher levels. It's the same thing you do when you create a map. It's the same thing you do when you're giving care. You know, you're using rationales and thinking about what is appropriate, what isn't, and what choices and decisions to make. And then finally, before beginning the map, be sure to sketch out a rough draft. We talked a little bit about taking sticky notes and taking a big piece of paper, you know, even if it's newspaper, preferably blank paper, but if that's all you have, you know, lay out your format. Some students have trouble with mapping because they get so caught up in the layout. Again, that's because your brain is looking at this differently. Get so caught up in the layout, you don't think about the content. The true magic of the map happens with content, because that's where what you put in the map shows your understanding of it and what level of understanding that you have. So if you want to work on a map for me to look at, I would be happy to do that. You know, but we've had a couple times in class to practice, and we'll have some time again. And you know, hopefully that will help people to understand it, because they're only going to get built upon and get bigger and more complex. So this is a very simple stage of static mapping that's going to help you to solidify your content. And then eventually when we go into the care planning, that of course is going to be a little less static, which means you have to think of more things and you will get lost. So you have to know this part. So and then when you make your rough draft, you can even take, before you finish your map, complete it on paper first. Think about some of the things you're going to include beyond just those main connecting concepts. And think about your connecting phrases, jot some of them down. And then when you put it all together, you know, it makes more sense. You can even state some of the connecting phrases out loud, because that would help you to kind of sound it out and walk through it. So this imagery, visualization, creativity, is part of all nursing care, and it starts here in the nursing education. So hopefully this helped you a little bit. So if I was going to start a map about NANDA, you know, I would put NANDA in the middle, and I would say something like NANDA is comprised of, that would be a connecting phrase, and I would say 13 domains. All right, and then I would say which look at a patient holistically. You know, and in addition, they consider the physiologic components as well as psychosocial components. And that would include culture, diversity, financial, all the other things. That you can make this map a lot bigger than that. But I would put down what NANDA is comprised of, which are the domains, how it looks at a patient, and then how it's used in a nursing process. So we know that once assessment is completed, all right, and we have collected the data, we've validated it and organized it. Now we're going to come and we're going to make a problem. We're going to state it. So if it's a NANDA approved, we have to use those three components that include the problem, the etiology, and the defining characteristics. We have been over that many times. Okay, so if you still have questions, bring them tomorrow. But I'm hoping that this helps a little bit. If it would help you to do a map on electronically, go through the book in your access code, because there's a concept map creator at bubble.us, and you can practice there. But I think for most of you, learning better on pencil and paper is better, as it allows you to play with formats, erase it, start over again, and gives you a place to start. It's also a very good study tool. So and please make an appointment with me if you feel like you need to, so I can help you the best that I can. And that's pretty much it for today. I'll see you tomorrow, and we'll see what we come up with next.